Hello, I'm Julie Miller from Focus on Dementia, and today I'm in conversation with Joan Hogg, who's a Dementia Support Facilitator, DSF for short, for the East Edinburgh GP cluster. And Joan's role was created as a result of an improvement programme to test relocating post-diagnostic support into primary care. So I'm delighted that she's joining me to chat about what her role entails. So hello, Joan, nice to see you, and thanks so much for meeting me.
Hi, Julie. Thank you for inviting me along today.
And you're going to tell me about your role, Joan?
Yes. I work from 8 GP practices within East Edinburgh GP cluster, providing post-diagnostic support in a primary care setting. I offer one-to-one post-diagnostic support to people newly diagnosed with dementia and support to their carers and families for a period up to 1 year. Each person's circumstances differ from one another to the next, so it's really important to spend time working on building trusting relationships with both the person with dementia and their carers and families. We offer a blended service. It's their support, and it's important they choose the support they want and wish to receive. Some choose visits, others telephone support, near me video calls, and often going for a walk, and some choose a combination of all options. They set the timescales. Some want every 4 to 6 weeks. Others need several visits as needs require. And that can be initially, Julie, when I may be implementing or putting in place some support packages for them, or enabling them to go along to something that they'd like to participate in. And other people have difficulty at the beginning coming to terms with their diagnosis, so maybe don't want much support at the beginning, and I have to work hard to keep in contact with them. But I always work on the proviso that the person with dementia can call me, or their carer can call me at any time if needed, and I try to be as accessible as possible. With my manager, I've helped to organise and run group work, and pre-COVID we had 5-week course and had various professionals come along to talk. During COVID, we had 2 very successful virtual groups run on a monthly basis, enabling the person with dementia to come together and meet others with their carer in a similar situation and benefit from peer support. I also attend weekly community mental health allocation meetings chaired by the consultant Dr. Anderson. It's attended by nurses, OTs, psychologists, and also the Alzheimer's Scotland link worker who works in my area. We discuss patients that are newly diagnosed, referrals made to the community health team, cases where there are concerns, perhaps increased behaviours, and everyone is really supportive. We can ask or report back on any patients and ask questions. Prior to COVID, I would attend GP coffee time meetings, quite informal, where we would just chat about patients and I could bring people up. Obviously, during COVID, these meetings ceased, but I'm hoping they'll restart again. I've worked really hard to build relationships with other professionals and work closely and collaboratively with the GPs and their staff team, with the memory clinic staff, the mental health team, social care staff, third sector organisations, to name but a few, but the list is extensive. I feel communication is vital and is a key element of my job, whether face-to-face, virtual like Teams, emails, telephone, to ensure that the best support is provided to the person with dementia and their carers.
Yeah, so a very, very complex, busy role that you've got there, Joan. And you've already mentioned the Alzheimer's Scotland link workers there, but how does your role fit with those workers?
Well, just like the Alzheimer's Scotland link workers, the Alzheimer's Scotland 5 pillars model provides me with the framework for working with people living with a dementia diagnosis. I work closely with the link worker in East Edinburgh to try to avoid duplication of services, and that worker attends the community mental health allocation meetings weekly, so we see one another over Teams, and you know, again, know what one another's up to. The current link worker has also worked with us previously on face-to-face group work, and she's really a great support for me. So peer support is important when you're working sole worker, and it's really been quite good. There are plans to have me attend some of the Alzheimer's Scotland link worker meetings to share work practices and ideas, so that's something for the future. My role kind of differs from the Alzheimer's Scotland link workers because it's based in primary care, working from 8 GP practices. Since inception, the service supports everyone newly diagnosed. And another part of my role, which has become even more important during COVID, and has been support of people with mild cognitive impairment pre-diagnosis. So my role is to help inform people, prepare and understand the assessment process, and support them up to diagnosis if required. It's been really successful because it has been meeting an unmet need. I can access GP records and have ability to update and record notes, and GPs can see at a glance the support a patient is receiving.
Yeah, fantastic. And you probably answered my next question. It was just about where do you see the benefits of being attached to primary care, but I think being able to access GP systems seems to be one of the key things, you know, that you can update records, and am I right in thinking that you upload small personal plans that people have produced, that information is uploaded to the GP system as well?
Yeah. And that can help, Julie, with you know, at the end of the support, and it can help the GPs when they have an annual review. But one of the things that important parts of the benefits is I can check the GP list of patients newly diagnosed in the last 12 months, ensuring that nobody falls through the gap. And I do this every 8 weeks, so it's a continual. But because I'm attending the allocation meetings now, we're picking up, both the link worker from Alzheimer's Scotland and myself are picking up on people a lot earlier. And I think the supporting people with mild cognitive impairment and pre-diagnosis, GPs now have somewhere to refer for support. And I think that's quite vital. I'm able, as I said, to access GPs and get their help and support and guidance on difficult situations that perhaps are happening with people, and, you know, behavioural changes. And that's resulted in perhaps, you know, GPs getting in contact with the community mental health team, and a mental health nurse being out within days to assess and support. And just a couple of other brief examples are, I have access to the GP pharmacists for people who are not managing to take their own medication safely, and arranging a set so the person can continue to take their medication, you know, and carers can easily monitor compliance. And the other main thing is creating and adding to the key information summary on the KISS on the electronic part of the GP records, with information on patients' current care, their family, their package, their power of attorney, their future wishes, and all that shared with out of hours in hospital and in some social care settings. So it's quite an important part.
Yeah, absolutely. And what's the future for your role, Joan?
The future is, my post has been funded for a further 2 years. I'll continue to work daily from within the 8 GP practices. I'm now integrated into the older people's community mental health team based at East Neighbourhood Office, which is great as I'm part of a team which includes the community mental health nurses who I already know. They've already been a great support, and I'm learning so much from them on a daily basis. And it's hoped that the service will be extended across the city. So Julie, watch this space.
Yeah. Oh, thanks ever so much for talking to me, Joan. So if listeners want to learn more, there's just so much learning from this programme. If people want to learn more, look out for other short videos and resources relating to this work on our Twitter feeds. So thanks again, Joan. Bye for now.
Thank you. Thank you. Bye.